Cool. And we are live. Welcome, welcome to the Let's Talk About Ebola discussion. My name is Christopher Ree. I'm the current chairperson at the South African Medical Students Association. And tonight we're going to be talking all about Ebola. And we have a panel of 10 medical students from all over Africa who will be sharing their own personal insights with us and their experiences around this topic. Currently, we're in the midst of the greatest Ebola outbreak in history. The first major surge of this disease occurred around February this year. Since then, there have been over 1,000 cases of individuals who've contracted this viral hemorrhagic disease. In the wake of this medical crisis, medical students from all over West Africa have started the Kick Ebola Out campaign. So this evening, our goal is to provide a platform for these medical students to express themselves and to spread awareness for this disease. We want to find out how these students' lives have been touched and disrupted and impacted by this outbreak. And we hope that their stories and their personal experiences will provide an insight to the world at large. This evening is also about forming a junctional meeting ground for medical students and young doctors to hopefully move forward and start new projects of student activism. So an outline for this evening's event, we're going to break it down into 3 parts. The first part is just an introduction around the Kick Ebola Out campaign, and we'll be hearing from Sierra Leone and Guinea about how they got this started, why they got it started, and how maybe other students can get involved there. Secondly, we'll be doing a Q&A with the audience. You, the viewers, will have an opportunity to ask our panel of 10 medical students any question that you like about their experiences with Ebola. You'll see in the bottom left-hand corner of your screen, there's a little button that says click to participate. So what you do is you click that, and then you'll be able to submit a question. From there, you can +1 other people's questions, people can +1 yours, and the one that is the most popular will get the panel to answer. So you guys can actually start submitting questions now. And then by the time the introductions and the introduction to the Kick Ebola Out campaign are done, we'll be able to start addressing those questions. I also just ask for your guys' patience because our entire panel from this evening comes from Africa, and in certain parts of Africa there are definitely certain connectivity problems. So if we do happen to drop one of our panel members, we'll move on and we'll just make the best of it. Can we just do a mic check, please? Chair? Thanks. So without further ado, let me please introduce our panel for the evening. From Sierra Leone Medical Students Association, we have Asad Naveed, who's currently the president of the organization. With him we have Dr. Boy Jallo and Abdul Jabril, also from Sierra Leone. From Guinea Medical Students Association, we have Hadia Diallo, and she is currently the president of that Medical Students Association. From Tanzania, we have Gerald Makuka. He's the previous African Regional Coordinator for the International Federation of Medical Student Associations. Then from Rwanda, we have Magnifique Arakoze, who is currently the president of their students' organization there. From Uganda, we have Ivan Lumu, who was the most recent president of their medical students organization. Then, from Kenya, we have Megi Mwaka, who's currently the regional coordinator for Africa at the International Federation of Medical Student Associations. Then, from Nigeria, we have Eche Ugo, who's currently the president of their Medical Students Association. Then, joining us from South Africa, we have Matthew Apostolou, who's our head of IT and is the magic behind the Hangout tonight. And then we have myself, Christopher Reed. Okay, so let's get into this. I'm just going to ask Assad and his team from Sierra Leone just to tell us what you can about the Kick Ebola Out campaign. And then also can we do a mic check? Eche, please mute your mic. Assad, go ahead.
Hello everyone. First of all, thank you for joining us. So I will quickly want to introduce you to the Kick Ebola Out campaign. Actually, Kick Ebola Out campaign is an community awareness campaign, and it is currently done jointly by the Sierra Leone and the Guinean Medical Students Association. Basically, what we do in this campaign is that we go to communities, and in these communities, we go house to house and door to door and tell people about Ebola. Because actually, Ebola is a very fatal disease. As once someone catches it, most likely the case fatality rate is 90%, which means most likely you will die. So the best way to save yourself from Ebola is to follow the preventive measures. So basically what we do is we tell people the preventive measures when we go to their houses. And to do that, basically we tell them about the signs and symptoms of Ebola disease, such as headache, vomiting, diarrhea, which can be bloody, fever, sudden fever. We tell them about the signs and symptoms. After that, we tell them about the preventive measures, such as washing your hands regularly and not touching, not eating bushmeat. Thirdly, not shaking hands just like that with everyone to avoid body contact. Fourthly, not to touch dead bodies, which body of someone who died of Ebola. And lastly, to report anyone who has the signs, these classical signs and symptoms of Ebola virus disease. So these are the prevent.
And then Assad, can you tell us how you guys came about starting your Kick Ebola Out campaign? How did that happen?
Well, it happened because we saw the need that the awareness being done currently in Freetown, for example, is by non-medical people. I mean, people not in medical school or not doctors. So the information they were giving the people wasn't very accurate. And so we thought that it's better we as medical students go out and give people the accurate information about the signs and symptoms and the preventive measures. So based on this, we launched this Kick Ebola Out campaign. It was also presented in the recent IFMSA General Assembly with the help of our great regional coordinator, Gerald. And basically that's how it all started.
Okay, thank you. And then Hadia, can you tell us how Guinea has been involved on a medical student level in the Kick Ebola Out campaign?
Hi everyone. Like you, um, I just want to ask you to beg me, because I will not talk a good English. So you will try to understand what I'm saying, okay? There in Association of Medical Students of Guinea, we have to go to the community and inform him about Ebola prevention, about Ebola symptoms, about how to prevent of the disease, and also how to inform the authority when somebody have Ebola in the community. So we use this flyer to explain everything to them. That is the meat of the dom. The meat of the community will not eat blood, and there is Ebola virus. Okay, so there is the symptom: fever, vomiting blood, bleeding, bloody diarrhea, and also skin rash. After, this is a prevention: not eat this meat, and also don't touch somebody who is sick. And the big prevention is to wash the hand with chlorine or soap, to call 911 if you have somebody who is sick, and also disinfect all the house.
Okay.
So that's a message that we tell to the community.
Okay, thank you.
But like Assad said, we are going to do the same thing. In Sierra Leone, they are doing like us in the family, and they also want to sensibilize the students after the holidays. Is the same for us. Before holidays, we are sensibilizing the students, but now we are sensibilizing family. So the chance for us is, for the first activity, we are working with UNICEF. So for this second activity, we have this chance too. They are financing 1 month of our activity in the community, and
Okay.
give us soap and chlorine, also flyer and t-shirt for make our sensibilization.
Okay, thank you,
Thank
Hadia.
you.
And I'd just like to say as well, at this point in time, that these awareness campaigns, and also just with this discussion this evening, that we're still medical students and we're not sort of qualified doctors yet, so we're not giving sort of medical opinions. We're just trying to spread awareness about the disease, and just share our own sort of anecdotal stories. So before we go on to further questions, let's get one more question for the Sierra Leone guys, because a lot of what they do is about clearing up the big misconceptions about the disease, and not sort of giving specific medical advice. So, for instance, the mortality rate of the actual virus at this point in time, I think, is still in dispute, and not entirely sure. However, Assad, can you maybe tell us what some of the largest misconceptions are that exist within your urban and rural communities in Sierra Leone?
I think Dr. Boy can answer this one.
Hi everyone again. In May on the 25th of May this year, that was when the first Ebola case was reported. And it came through a female traditional healer who apparently went to Guinea to attend the funeral of a relative and a patient of hers. When she fell sick and died of Ebola, following that, some of her relatives also died. People in the village thought it was due to witchcraft. And up to date, we are still having that misconception out there. We have people who say, Christians and Muslims alike, who also say it's due to a curse from God. So we have difficulty convincing them that this is a particular disease that is well known in literature, and that it's viral infection, and the way to treat it is to come to hospitals for attention. So that's one of the main misconceptions about the disease, that it's due to witchcraft or it's due to a curse from God. Some of the other problems that we have been facing as a country, foremost, is the issue of politics. It started in a part of the country where the opposition has a stronghold, and we were about to have a national census. So people thought this was a political move to limit the counting of people in that part of the country. It was not until we started having patients in Freetown that was when people realized this is a national problem. And also, another problem we have is, in this country, our social intercourse is very, very high. People, complete strangers, meet with each other. They can share things, they can share amenities as if they are family members. People come in to help total strangers when they are in need, carry them around, care for them. So when we have the case of Ebola patients leaving one part of the country, going to another part of the country, if even they don't have relatives, total strangers take them in and care for them. And in that way, the disease spreads. So people still having difficulties limiting contacts with outsiders, with total strangers, talk less of family members. Even if you tell them your relative is now confirmed to have had Ebola viral disease, they still want to care for them. They still don't mind hugging them, touching them, helping them with whatever they need. So now government has to come in and have military personnel and police personnel in these homes or in these hospitals, so as to limit contact, to limit interactions between patients and their relatives. So these are some of the major challenges that we are facing, and up to date we are still having new cases being reported. We have up to 743 reported confirmed cases, about 250 deaths, and 220 discharges from the various treatment centers. So if you ask about the major challenges, that's our major challenge with the social interactions. When it comes to the hospital setting, one of our major challenges has been people's adherence to universal standards in terms of infection control. So we still have hospitals running out of gloves, and nurses or medical personnel caring for patients without gloves. And we still have limited supplies of personal protective equipment in our hospitals. But that's been addressed by the government and our international partners. But the major challenge is we still having a problem of denial among the population. People are not coming forward when they have symptoms, and they are keeping their relatives at home until when the disease has progressed, it has really advanced, when they will have had other members who are already infected and are in their incubation period. That is when they report at hospitals.
Okay. Can I just hello?
Yeah, and I was gonna put it for another question forward just through to the Sierra Leone guys. What is it like? What is it like being a medical student, sort of at the ground level there, having Ebola patients in your isolation wards or at your hospitals? And do you have Ebola patients sort of at your learning hospitals? Maybe Abdul, can you tell me about that?
Yes. Hello, everyone. It's quite an experience, and as everybody here is new to it, from both the patient, the medical staffs, and even at the political level. When it all started, I was at the pediatric hospital unit, and there I was doing my pediatrics posting. I was also preparing for my exams. And once the outbreak was announced and the initial effects started with, as Dr. Jallo was saying, patients not turning up for hospitals, and there's this down turning the turnouts that started, and that's basically because initially most of the patients that were being taken and dying. As we know, the disease has a high fatality rate, and so most of the patients stopped coming to hospital as they were seen as a death sentence, or they were going to be diagnosed as having Ebola, and so the turnouts dropped. And once we had a first case of a suspected case of an isolation that was isolated at the hospital, again, that's just added to the stigma. A lot of people are saying there is Ebola at that hospital, and so they stopped, just disappeared. And like I was, for the week that we isolated the patient, I was at the emergency unit, which is normally very much busy, very occupied. You can even run out of beds, and for that particular week, you're having a situation one family can have as many beds as they want, and you're just not patient turning up. So that was the effect on the hospital basis, and it was really frightening for everybody, and with the students, the doctors, the young doctors, and so it's not just not the patient they were frightening. Even the doctors and everybody was a bit anxious, and we measures were put in place to use of gloves, more protectives, but the anxiety and the fear was there right across the board from all levels. And that was basically the effect of having an isolated case at the hospital had on us, our students, and the entire staff at that facility.
Thank you. Thank you. And just to make sure we get a word in from everyone, recently Ebola sort of hot borders through to we've just lost Asha. I was going to say it's just hot borders through to Nigeria. We've just lost Asha. He's the president of the Nigerian Medical Students Association. As soon as he gets back, we'll ask him about how it's been affecting them there. Maggie, you as the Africa Regional Coordinator, what's your view on the Ebola outbreak and the involvement of students with regards to this?
Hi everyone. So with regard to that question, I, as a medical student, I can empathize and only imagine what the other medical students must be going through with the fear of having a patient with Ebola coming to their hospitals. So in great support of what Guinea and Sierra Leone are doing, the Kick Ebola campaign. And I guess what I'd just say is that we need to have more of such campaigns to enlighten people, to get rid of the myths and the misconceptions that the virus has, and just for our own safety as medical students to support each other.
Okay, thank you. So it seems that the Q&A app doesn't seem to be going through. However, there is a backup for that. I can ask the audience that's watching on YouTube currently. You guys can also post questions in the comments, and you can up and down vote those questions. So for those comments. So go ahead and do that. You'll see it's just below the video, and we'll get to answering those so that we can hear from you guys what you would like to ask medical students about this whole Ebola situation. Also, again, just to our panel, if you guys have questions, please post them in the chat section of the Hangout group. So moving along, another question for the Sierra Leone guys. What kind of policies do your universities, or have your universities put in place to either protect the medical students or at least make it socially okay to not have to be exposed to Ebola patients? I mean, have they done anything along those lines? Exactly.
Yes, hello again, everyone. Like I said, during the time, it was an examination period for almost all the faculties at our college, and the cases were not confirmed for the area where the college is as the capital city, and so we're still having classes and we're still going to have the exams. But on they have to put measures, the use of gloves compulsory, and make sure that you're well dressed and well covered before you come in contact with any patient. And it was only when it was absolutely necessary that we would get to the patient. For instance, in one case that we were having exams, it was for one faculty, it was only doing the exams, and doing the exams was minimal contact, and certain examinations had to be taken out that had to do with also looking out of the mouth, doing vaginal examinations. Those things had to be taken out, and it was just display of in gloves, and you do this simple examination. So those things were modified just to reduce contact. As we know, the virus is high in bodily fluids, and the exams has to be NPCs. So we went through the exams, and once after the exams, we are closed, and currently we're on holidays, and the government has announced that the dates for reopening is going to be definitely deferred till things are under control, and that's just cut across for medical students and as well as other courses in the university school. So basically, that has been the response from the university authorities.
Okay, thank you. And then just to continue down that same sort of avenue of questioning, we've got a question in from I hope I'm saying this right, Gulia Regio. Okay, she asks, what's the procedure when a patient with Ebola comes to the hospital?
Good. Hello, everyone again. It's good you asked that question, and that also will help to guarantee the safety of medical students as they work within the hospital environment. There is what is called a screening mechanism that has been put in place in almost all hospitals in the country. When a patient comes to the A&E, the first port of call is at the screening unit, where we try to ask them a couple of questions to see if they've had any of the symptoms. We lay emphasis on acute onset of fever, coupled with symptoms such as headache, abdominal pain, nausea and vomiting, anorexia, hiccuping, and others which are non-specific symptoms. Then we ask if there are any hemorrhagic symptoms like epistaxis or bleeding from other orifices, which in the case of the current Ebola viral disease epidemic in our country is not evident in most patients. If patients do have fever with 3 of the non-hemorrhagic symptoms, plus history of contact with a patient who was sick in the last 3 weeks prior to presentation, or haven't attended a funeral of a patient or someone who died and you don't know the cause of death, or haven't cared for someone who was sick, be it at home or at work, then straight that particular patient is classified as a suspected Ebola patient. And then immediately the individual is isolated with strict nursing barrier measures. Thereafter, we collect a blood sample, which we send to the lab, and while awaiting the result, we assume it's an Ebola case, and we take all the precautionary measures. We see these patients with protective personal equipment, and while they are there, we treat them with empirical treatment, such as give them antimalarials, support them for fluids if they are dehydrated. If they are conscious, we give them oral fluids and oral medications. If they are unconscious, then we give them IV medications, and we cover them with wide spectrum antibiotics. And then when the results come, if they are Ebola positive, they are transferred to the treatment centers in Kenema or Kailahun. And 2 more centers are being constructed currently, one in the western area and a second one in Kenema. If they are negative, they are then taken to the general wards, and then we give them routine care. Now, those who are involved in the screening and in the treatment of these patients are specific teams, focal teams. Not even all doctors are concerned with the management of these patients. The moment a patient is labeled suspected Ebola, from there onwards, he or she is cared for by a specific team, and other doctors are not involved, and definitely medical students are not involved in their management at all. So this is how we limit contact between these patients and the members of staff, with medical students and the general public.
And then, are you guys scared? I mean, what is it? I mean, are you guys scared of, you know, because if a patient presents with only sort of vague fever and, you know, symptoms like that, and you don't really know yet that they have Ebola, I mean, are you guys not afraid of coming across a patient like that and having sort of accidental exposure?
Of course, to be honest, we are scared, and but that is good that we are scared. It means we'll take we'll take in or practice the extra measures to protect ourselves. But we have no options. We have to see or care for these patients. The message that is going out to the public in social media, in electronic and print media, is to encourage people to come to the hospitals and seek care for any reason, for any disease. So if they if they come to the hospitals and we don't care for them, they will continue to stay at home and infect more people. And that way we get infected through our family members. And as I told you earlier, social intercourse is so much in this country. So it's either I know someone who has the disease or I know someone who knows someone. In my hospital where I work, we already have 2 victims, 2 nurses who have fallen ill, and one died yesterday. So we are really scared. We've lost 2 doctors to this epidemic. We are scared, but we have to do the work, and all we have to do is to be cautious as we discharge our duties.
Okay, thank you. I'm going to put a question forward to Gerald now, from Tanzania. It's the, and I remind you as well that we're not qualified doctors just yet, but it's this, can the virus be transmitted by air?
Thanks, Chris. Well, the virus, as we know of, is only transmitted via fluids, which can be in the form of semen, blood, and so forth, or even in terms of skin and skin which has got any source of wound. So via airborne, it is not transmitted, and I can say that we are thankful for that, because if it was via airborne, and then I think that that would be a very, very scary bit. Yeah.
And how's it going in Tanzania in terms of Ebola? What's the awareness like there?
Chris, we want to add a bit to the previous question.
Yeah. Concerning its airborne nature, it's not been confirmed yet, like established, but there are some hints that it could be transferred via air droplets. And so we are also careful. Even when we screen patients at the A&E, we make sure we maintain some distance, and caring for them, we always have masks on. Some are even bitterly arguing that it's airborne, and this also born out of a research that was done in Canada, where monkeys were put in the same room and put in different cages, and then some of them were infected with Ebola. Eventually, some other monkeys contracted the disease, and there was no evidence of direct contact between these monkeys, and so for that we are careful. The research is not conclusive anyway, but I advise colleagues who are in these countries to be careful. Treat this as an airborne disease. That's the better thing to do at this point.
Okay, so again, just to reiterate, at least as far as I've read, and again, we're not qualified health professionals just yet, but as far as I know, the disease isn't transmitted via airborne. However, they do make a good point, as in a high level of suspicion could be life-saving. So to answer another question put forward from our viewers, this one comes in from Christiane Roberts, and it goes, are you given advice by the universities on how to handle the panic that Ebola has caused with regard to patients and their loved ones? And Asad, can I ask you maybe to address this one? I think you guys have experience with it.
Well, to be honest, we haven't been given any advice from our university. All the advice we are receiving is from Ministry of Health and the WHO. The guidelines currently we have are from Ministry of Health. The university has not given any specific advice. What they have done for now is they have cancelled the classes. We are no longer going to the wards at Connaught Hospital. Before we were going, what they have done for us medical students is that they have cancelled the classes completely, but they haven't given us any advice. In our sensitization and awareness we are using the Ministry of Health advice and their flyers and their posters and their information to tell people how to take this situation, how to if you get someone in, for example, if you get someone infected, what to do, what steps to take. Yeah.
Okay, thank you very much. So I'm going to also put forward to our viewers to maybe ask some questions surrounding the impact that this outbreak has had maybe on the day-to-day lives of our medical students in Western Africa, and sort of just as students, how that may affect them. So again, just to our students in West Africa, how have sort of these disease cases affected your lives personally? Has there been anyone in your immediate group or circle of people that has been affected? And if so, how are you guys dealing with that? And we can start with Abdul, then back to Assad, and then if yeah, we can go like that.
Hello again, everyone. Unfortunately, I haven't had any family member or any friend or so. The only very close incident is involves two of our lecturers. One being the only specialist the country had in hemorrhagic diseases, that's Dr. Sheikh Umar Khan, who was a lecturer to us at the clinical level, and he was the very closest we've lost, and then Dr. Cole, who was also in the hospital that most of us are post doing our clinicals. And so those two have been very touching for us, and they, these were the people who we could have turned to if there is any problem, as they are leading people in this fight. And so that had a very huge impact on us all as students, and it was really moving, and for most of us it was a very tough moment to go through, and that's the closest really as for somebody who know who suffered from the disease. Yeah.
Assad, from you guys' side?
Well, I can add a bit about how it has affected us. We are currently missing classes, as I've already mentioned earlier. We are no longer taking classes. We are no longer going to the wards because we have been advised by our head of department of internal medicine to wait till the situation gets better. So basically, we are no longer attending lectures and going to the wards. That's the first thing. Secondly, as my colleague has mentioned, Abdul Injai, we were affected by the Ebola in another way by losing these prominent doctors. For example, Dr. Sheikh Umar Khan, he was also our lecturer, and he used to teach us internal medicine. And he was a very passionate lecturer, very good. He really demonstrated when teaching in practical terms. He was good in always, so he was very close to us, and he used to come from the Lassa fever ward in Kenema every week to lecture us. So it was a great loss for us because we have lost a lecturer, a committed lecturer. And the other prominent doctor was working at Connaught Hospital where we work currently, where we are taking classes currently. So when he died as well, people got scared. We got scared because that's the hospital we go to every day, and the one of the leading doctors of that hospital passed away recently due to Ebola. So we're really scared. Yeah, that's.
Okay, thank you, Assad. Maggie has a question she'd like to put forward to the panel. Go ahead, Maggie.
Hi, thank you, Chris. So I'd just like to ask to the other panelists, Ivan from Uganda, HF from Nigeria, so many in the countries which still haven't had the outbreak, if they've undergone any emergency protocols that they in their schools to prepare them for the outbreak in case it happens.
Maggie, can you say who you're addressing that question to again? Maggie, your microphone's on. There you go.
Sorry, it was to Ivan, Eche, and Gerald. And to you, the SAMHSA students as well.
Okay, so I think Ivan, you start, then we'll go to Gerald, Magnifique, and then Matthew and myself. So go ahead, Ivan. Okay, Ivan doesn't seem to be responding. Go ahead, Gerald. Gerald, are you there?
Thanks, Medifel. Currently, protocols. Hello? Yes, can you hear me? Yes, currently there have been no emergency protocol in the medical schools. However, there have been protocols have been taken at the airports whereby there are now precautions. And as soon as you enter the country, you are given a form and you're asked to fill the form and ask where have you come from in the past 21 days, and also if you've had any other symptoms. But currently, there are no other protocols that have been taken place.
Okay, and then let's hear from Matthew about the protocols in South Africa.
Hi, Chris. Okay, well, as far as I know, the protocols we have for medical students are limited. We don't have sort of much that we've been told. We also don't have a sort of set guideline in our academic program, or at least at the University of Pretoria, the NICD, to discuss patients. And these protocols are issued to all private and public practitioners and health facilities. And yes, so it's basically blood tests. They check temperatures and then admit patients as precautionary measures if they feel that there might be a risk for developing hemorrhagic fever.
Thank you. Magnifique, what's happening on your side of the world? Okay, Magnifique's audio doesn't seem to be coming through. I apologize to our viewers. Try unmuting your microphone. Okay, yeah, no, still no audio technology here. All right, let's go back to some of our questions from our viewers. Sorry about that, Magnifique. The most popular question at the moment from our viewers is, has there been any developments regarding a proposed vaccine from Vanya and Mishka? Again, I'd just like to ask if the audience sort of steers their questions more towards the experiences of the medical students, because we're not any type of authority, or we know about as much with regards to the vaccines and all that as I think most of us. However, let's hear from the guys in Sierra Leone what they have to say about what they know about the vaccines. Go ahead, what's up?
I have a question for all the participants. I would like to know, those from non-affected countries, what would you like your governments to do? Will you rather see them continue trading or doing business as before with affected countries, or would you like your borders to be closed to these countries?
Okay, we'll start with Gerald, then Maggie, Ivan if he's there, and back to Matt. What would you like your countries to do? Keep your borders open or closed? Go ahead, Gerald. Gerald, can you hear me? Okay, Gerald's not responding. Maggie, go ahead.
Thank you for the question. So what I'd like to see my government do is I'd like to see them strengthen the surveillance systems. I'd like to see them ensure that each and every citizen knows the emergency protocol in case they see anyone or find anyone who has the signs or symptoms that would be suggestive of Ebola. So mainly it's to have health education with regards to Ebola and to strengthen the surveillance systems and the health systems within the hospitals, such that if a patient comes, there is a proper system as to ensure that they prevent further spread. So isolation rooms, how to quarantine in terms of the personal protective equipment.
Yeah, I'm going to ask Joe again if he's there. If you'd like to give a comment.
Yes, this perspective, we have not closed our borders, and our borders are still very much open. However, we are now trying to do, like Maggie has said, to strengthen our surveillance system, and also to strengthen our public health system. So that's what we are currently doing. But our borders are still open.
Okay, and then just from South Africa, I can say that our borders are still open as well. What I would personally like to see, I think, just within our own country with regards to Ebola, and this is just from sort of the perspective of a medical student and what I'd like to see for the students, is just the sort of universities as a whole, sort of the 8 universities that we have in South Africa, just take a moment to develop a policy for medical students with regards to what to do in a Ebola situation, so that we don't have to and ah and wonder, should I, be on call today because there might be Ebola patients or something like that, and then also just to give us a proper protocol to follow, because I think what's happening now is a lot of the guys don't really know what to do. I mean, we had a guy come into our intake the other day who had a travel history and a fever, and in this situation it's either malaria or Ebola. So when that happens, do you as a student step back, or do you keep on helping your patient until you confirm that it's Ebola? So it would just be nice to have a piece of paper to back students to say, look, I feel uncomfortable with the situation, and to have our senior doctors back us on that as well. Matt, what do you think?
I agree, Chris. Look, I've seen what the protocols are in the hospitals that in Pretoria, where I work, and there isn't a sort of clear protocol. We do have patients coming in, and there is a lot of mismanagement in terms of how to approach a patient who might have hemorrhagic fever. There are 11 designated health facilities in the country that are there to manage and report Ebola cases. And we have also dispatched a specialist team in response to the virus in Sierra Leone. But in terms of medical student education, we really haven't had a lot of background info in terms of current issues, in terms of, we follow a set guideline or sort of set program in our curriculum, and any sort of health issue that might arise is totally ignored. They only deal with what is in the program at the time, and I feel that it should be sort of made known to the students. I've also been listening to the radio quite a lot, and there is a lot of misinformation on a lot of the radio stations. I've heard some of these DJs commenting and giving some terrible advice to the public, and that's something that also should perhaps be regulated, should perhaps be looked into. So yes, I think those are sort of the key things that I've seen.
Okay, thank you. Yvonne, what have you guys been seeing happening in Uganda, and what would you like to see happen in Uganda? Haven't you there? Okay, he's unresponsive. We'll take the top question from our viewers. And this also then brings us into sort of the last half an hour of our talk, where we're going to try focus more on how can the world get involved, how can other medical students get involved, what can anyone do to sort of contribute to the Kick Ebola Out campaign. So yeah, we're moving to the third part of our discussion tonight. So from Sandy Fari, what would you like the rest of the world's nations to be doing to help you and also help the patients? So again, let's start with Assad, and then we'll ask the rest of the panel.
Well, first of all, the main thing I think which we need in Sierra Leone is to do a lot of sensitization, firstly, because people on the street still don't know fully about Ebola virus disease and what to do if someone gets infected. So what we need to do in the countries that have become affected is to make sure every citizen knows about Ebola virus disease and how to prevent him or herself from this disease. So the first thing we want help with is in the aspect of awareness. Secondly, as Dr. Boy said just now, there are two treatment centers being built currently. Currently patients are being treated in Kailao and Kenema. They are building other treatment centers. So I think if we have treatment centers and doctors coming from outside to help, that will be very useful for us, because we are running out of doctors, of human resource, I would say, in Sierra Leone. So what happens is when someone gets infected in Freetown, he's currently transferred to Kailang, which takes like 8 hours because the road is really bad. So if there are treatment centers which are close, maybe it will help. We need more treatment centers. So maybe Dr. Boy okay, Injai would like to add from here.
One way that the other nations can help now is, one, they don't have to cut out from us like some other countries closing down on us or sort of quarantining the whole country, because that sort of decreases the morale back home here. And another way again it could be with funding. I mean, the government and MSF and the other institutions, NGOs, Medicines Sans Frontières, UNICEF, WHO, they're all complaining about funding. They all need financial helps, which they can get from the other nations which are not affected. Another thing also is expertise. Like from East Africa. East Africa is very much experienced. I think the most experienced area when it comes to this disease, and also the the other nations around the world have experts. The only one who we had died in the war, in the process, and so they can contribute. The other nations can contribute experts in hemorrhagic fevers, and especially Ebola, and that is in short supply now, because so it's not, when these centers have been built, the new centers at Freetown, Bo, and Kenema, we'll definitely need people who are more trained in these areas and will be able to help these patients out and so that we can have more people recovering from the disease. And the other way for the patients, the other nations can help the patients who are involved, who are suffering from these diseases. Some form of relief, because most of these patients, they are losing their belongings, because once they're infected, the Ebola response team try to get rid of their clothing and some other personal items in the household that they might have been living in the process of disinfecting the house and rooms. So these patients are losing, it's having some sort of an economic effect in their lives. And so there are ways the rest of the other countries which are not affected can help this patient by sending in things, beliefs, and for instance, today we have one of the opposition leader that's made some gains from England and is going around trying to give to some of these patients in the form of rice and some other things. But there are a lot of other patients. There are almost 2,000 patients now affected, and 1,000 have died. Over 1,000 have died, and some of these are breadwinners in their houses. The MSF was giving one report in wherein for a particular village, most of the strong men and women for that village have passed away, and it's only now kids and that young people are there, and these are orphans who these processes are resulting from this disease, the aftermath of this disease, that we are having orphans and people who will not be able to depend on themselves, who definitely need help. And so these are some of the things that other nations who are not affected with this outbreak can help these other nations which are affected to help us go through it and reduce also the after effects, the damaging after effects.
If I will add to what my colleagues have said, a rising problem now is the problem of stigmatization. Someone asked if to what extent are the preventive methods working? We cannot for sure say they are working fully for now because we still having new cases being reported every day. And one of the major challenge is the stigmatization now associated with the patients and those caring for them. Hence, that is giving people less of a reason to come to hospitals, because the moment someone is diagnosed as having Ebola, the government policy is to quarantine their house, their home, and keep everybody living in that home indoors for a period of 3 weeks. So during that period, they are cared for by government. However, even after the 21 days period, if they should go out, they want to interact with neighbors, neighbors will be afraid to interact with them. Even health workers, we are having this stigma being directed at us. For instance, some of us, we are called by some of our relatives and told not to report for duty because we insisted on going to the hospitals to work. Some health workers who are tenants, they are being asked by their landlords and landladies to leave their homes, their houses. So this is a major challenge, even within the hospital settings. Those who are directly involved in caring for Ebola patients, they are being stigmatized. Colleagues within the same hospital don't want them to interact with them at the canteen or at other places. So what I would like SLEMSA to do is to focus their message on how to strike a balance between people being cautious but not stigmatizing those who are infected. Okay, people have to be cautious. They have to protect themselves from the infection. Nonetheless, if someone has the disease, they should be brave enough to come forward, and those around should be supportive, not by touching them, not by clearing their vomiters or anything, but by giving them the moral support that they need. I think this will be something that will boost up the morale of health workers and of people so that they will report these cases. Otherwise, it will be difficult to have people coming to the hospitals if they know that they will be stigmatized by the health workers, and the health workers, it will be difficult to get them to come to work when they know they will be stigmatized by their communities. In fact, these days, if some health workers have reported that when they board a public transport, other people will refuse to board those vehicles. As they go to work, if they board a public transport, when other people come in, they will sit far away from them, or they will even refuse from boarding. So this is a problem that is now emerging, that we are learning of, and I think it would be good if SLEMSA directs its sensitization campaign on overcoming the stigma. Thank you.
Okay, thanks. Alrighty. Yeah, so Matt, you wanted to talk about a Indiegogo?
That's right, Chris. Yes, I was sent a link through by Assad earlier today, and this is the Indiegogo campaign for Kick Ebola Out. And you know, Indiegogo is a fundraising platform, so it's a great way to sort of you know, it is a flexible funding option. So the campaign will receive all funds raised, even if it does not reach its goal. So any contributions that people can make. That would be really fantastic. The objectives of the project, of course, as we know, is to educate communities, schools, and universities about how to prevent getting infected by Ebola, to educate how to do proper hand washing, to donate soaps and chlorine to the public for hand washing, to distribute flyers and promotional materials on Ebola to reduce the spread of EVD in our countries, those who are affected, and also to train medical students, pharmacy students, and other healthcare professionals on how to do public outreach programs. So the money will be used by Sierra Leone and the Guinea Medical Student Associations, and will be used to get things that will facilitate the sensitization campaigns, from mics to speakers to T-shirts with the Kick Ebola Out message, banners, and you know, anything that we can really make an impact. I will be posting the link in the description of this video once the video has ended. I'll also be posting a link to the in the comment section. So you know, this is just to the public. If you could please sort of make your contributions, even the smallest amount is great. So yes. You know, we can also make local fundraising and send them to the affected countries. That was just posted by Magnifique. So yes, it is an amazing platform. Any contribution that the public can make, please go ahead and do so. It really can make a difference. Thanks.
Yes, thank you. Joe, do you have something to add to that?
Yes, Chris. Well, the fact is that we should not let our brothers and sisters in Sierra Leone and Guinea and the rest of West Africa go on this alone. And I'm quite impressed by what they've been able to do up to the moment. So it's up to us now to join hands with them and to help them. And we can do this in many ways. And despite the fact that we as medical students are limited in certain aspects, but we can do awareness campaigns, we can do projects in our settings, because, for instance, in Tanzania, there have been a miscalling whereby certain hemorrhagic diseases have been thought of to be Ebola. Just a few days ago, dengue fever was thought of to be Ebola, and one patient was quarantined as a result, but it has been proved that it is not Ebola. Therefore, awareness campaigns and also health education are very important. And we should also be able to donate to our brothers and sisters in West Africa through Indiegogo, as well as fundraise in our own settings and send these funds to them. And this will be a great measure to them and will help them in their own Kick Ebola Out campaign.
Okay, thank you. So the links for the Indiegogo fundraising will be posted in the comments of this YouTube video. And I mean, this is a great appeal to anyone who watches this video. If you know anyone who would like to contribute to the Kick Ebola Out campaign and just give these guys a bit of a hand to do the good work that they're doing, please consider contributing. So we've got about 15 minutes left in this discussion. What I'd like to just touch on as well is this is sort of the Africa region's first attempt at using a Google Hangout to provide a platform to give medical students a voice. Personally, I think it's fantastic. It's essentially like we have our own little TV channel. As long as we can make it interesting enough for people to watch, we'll get people to watch. Now, this is a very low-cost option to getting messages out there. The take-home message for using a platform like this that I really want to just put forward to our panel and all medical students and activists in Africa is that we have the tools now to very easily broadcast our opinions and express ourselves online. The only thing that we need to do is have the initiative to put it out there. And a big problem with a lot of medical students and medically oriented people is that a lot of the time activism is not accessible to us. We don't have a lot of time to go out and be more active than we already are, because we have to pass our exams, we have to work in the hospitals, we have to do calls. I mean, our lives get pretty crazy. So just having an evening chat like this for an hour and a half and broadcasting it to the world, I think is a very attainable and accessible way of being proactive. So what we're going to do as well for other medical students or student activists, we are making the entire process that we went through to get this up and running and available. Our protocol for the Hangout itself, we're going to make available, and just sort of the soft script that we used for tonight as well, we're going to make that available, just so that if anyone wants to reproduce this kind of Hangout situation, or Hangouts on air, that they can do that, because there's no reason that you have something that you want to express that you can't use a platform like this. Yeah, that's so yes, please do donate to those Indiegogo on those links. Let's see if we have any more questions from our viewers. Sorry, it's just taking a moment to come up. Can I just ask, as well, as we're talking about fundraising, what kind of fundraising have you guys received, and what organizations have sort of sent it to you? I heard you guys mention the WHO. Who else has actually sent through either monetary funding or aid in the form of soap, or can you enlighten us on that, Asad?
Hello, everyone. Well, first of all, there is... Hello?
I think we might have lost him there.
Who are
There we go.
trying to do other projects. Money is being spent on a lot of things, such as... Hello?
Hello, you're there. Go ahead.
There are other organizations trying to get funding for things such as personal protective equipment, for drugs, for medicines, for sensitization, even for sensitization. So there is a huge competition here. Currently, what we have done, what locally is, we SLEMSA, through our previous funds in our accounts and through some local fundraising, like by going shop to shop with a dash card and asking people to donate. We raised about $700-800, and with that we have done a training where we trained all the volunteers on how to do an awareness. After the training, we have started the sensitization work. Apart from that, we have also started going to the media. We have already visited 3 radio stations where we are giving them information about the Ebola virus disease, and we hope to continue. We have also we're actually trying locally fully. We are trying at the Ministry of Health, but we applied 3 weeks ago. Up till now, there is no response. So we are trying. So that's why we'll need help internationally as well. And the regional coordinator also, we want to thank him. He did some fundraising for us at the General Assembly. We have also so basically that's what we have done locally. Because of the competition, we need help internationally. That's why we have put up this in the Google page.
Do you guys have a specific target for how much money you'd like to raise?
Well, actually, we want to visit about 30 communities in Freetown, because when we go to these communities, we have to make sure we print our flyers about Ebola virus disease, because we can't get them from Ministry of Health. Ministry of Health didn't have, only gave us the originals, so we have to multiply the flyers ourselves. And we need to get speakers and mics, because in some public places, apart from going house to house, we also visit some public places, and it is easier for us to talk to public using a mic, so we have to hire it for the day, like speaker and mic. We have to hire vehicles where these speakers can be put. And apart from that, we have to buy chlorine. We are trying to donate chlorine to the people for hand washing and to disinfect the hand. We also are trying to get soap, because hand washing is one of the methods through which Ebola hands can be disinfected. So to visit 10 communities, it actually costs us about $2,000 when all the expenditure have been put together. And the SLEMSA Ebola committee was the one which all decided on this budget by looking at the cheapest things possible. To visit 10 communities costs us about $2,000 to get, because each community is actually made up of at least 1,000 to 3,000 houses. So basically, that's it. Hopefully, if we can exhaust the 30 communities in Freetown, we are thinking of extending to other cities. Currently, we are just based in Freetown. The whole thing we have put together for the Kick Ebola campaign on Indiegogo is 10,000, which we hope we are making a committee, because some of this money is going to Guinea. It will be divided, so that's our total target. So we'll try to achieve it. Hopefully, we believe it can be achieved. So that's all.
Okay, thank you. So that's quite a substantial sum of money for students to raise and or put forward. Okay, we have only time for a couple more questions. I'm just going to ask our panel. Maggie, I think you wanted to say something?
Thanks, Chris. So again, amazing work you, Assad and Hadia are doing in Guinea and Sierra Leone. I just wanted to ask, what advice would you give other medical students that would like to carry out the same campaign that you're carrying out? And also, what challenges have you faced so far in terms of your preparation, other than funding? Maybe hostility by the community, and how have you managed to face that? Thank you.
Is Hadi online to add something? If not, I can come in. Well, when there's an outbreak, actually what happens is everyone becomes engaged. That's what is happening in Sierra Leone currently. So the issue is not only funding. The issue was for us even to get someone to train us was a problem because we wanted to have an expert in Ebola virus disease. So we had to go to the Ministry of Health and they postponed us first. But later on, we were able to get someone to come and train us. But the other good thing which we saw in our medical students is everyone is passionate here to volunteer because everyone is taking it as a national emergency. All students, in normal circumstances, if there's a meeting, maybe not everyone comes, not everyone will attend, but because it's an outbreak and everyone knows how dangerous it is, we were getting full support from students to they were coming on board to volunteer. So to mobilize students was not a challenge for us. The challenge was to get someone to train us, and those are the basic challenges. In communities, the challenges in communities, I would say some people are not at times ready to talk to you or receive your or listen to you because they don't know where you come from. So we face the challenge a bit. So the best way is to always build a rapport with the people, explain to them why you are here. You are here to tell them you are here to help and to inform them about this disease and to tell them how to protect themselves from this disease. After that, they will be very receptive. So I think that's the main thing. Maybe in Abdul can add more challenges which others can.
Okay, I think.
Hello, yeah.
Go ahead.
What I can add to that is that, like, as Dr. Jallo was saying earlier, we interact with the patient, and we try to reduce the stigma. One, around the hospital setting, because most of the patients are not turning up for hospital care. The hospital are IMTs, and this situation will create another problem because there are other diseases that are endemic in this area and that are causing huge mortality per year. So as medical students, we can step in there and explain better and then try to regain their confidence in the health system so that they can turn up. That yes, when they turn up, they're not going to be diagnosed immediately Ebola, except if they are showing the signs. Otherwise, they will be treated for whatever they have to be treated for. And so we try to regain their confidence at these community levels, and also try to let go of the stigma surrounding patients that are being covered or people who are the health workers that are working at these places. And then we also try to clarify certain misconceptions with regards to the burial process and other things, which for most of them are concerned. And it's really good that we stepped in because most of them were so saying that they're taking their people and they're not allowing them to do the burial. And so most of them are very much angry with that, given that this is a very religious country where people have procedures to treat people who have died and pay respect to them. But because they're not being given the body now as part of the control response, so most of them are not pleased with that. But as students, we're stepping in, we explain to them exactly what is happening and why they're not being allowed to do the burials and why the authority is doing it, and indeed that the authority is doing the burial in the right way, so that those who are Christians are buried the Christian way, so that when people die, they're buried according to their faith. Oh, thank you.
Hi, Chris. Can we answer some of these questions?
Yes, go ahead.
Okay, there's a question from Won Yun Lee, which states, up to how much extent are these preventive methods working? Also, I would like to know in detail what kind of preventive methods there are now. Well, actually, the types of preventive methods are as follows. Firstly, you need to wash your hands regularly because if you wash your hands, you can wash the Ebola virus away. Chlorine kills the virus, But soap doesn't, but it suspends the virus and it can be washed away from your hands. So that's the first preventive measure. You need to wash your hands regularly. Secondly, if someone develops the classical signs of Ebola virus disease, which include fever, vomiting, diarrhea, which can be bloody, body aches, joint aches, and if someone is presenting with these signs, you need to report that person immediately to the Ministry of Health. There's a number, there's a toll line which is free, 117. You need to report someone who gets these symptoms, because if you don't report the person and the person is staying with you at home, all of you can get it. So that's the second preventive measure. Thirdly, you need to make sure you don't touch the body of someone who died of Ebola, because the body is very contagious. Okay, so you need to make sure you don't touch the body. You don't go to a burial ceremony. You call the experts who will bury the body in a careful method. Lastly, you don't eat bushmeat. So basically, these are the preventive measures that have been put by Ministry of Health and WHO, and hopefully, if everyone follows them, if everyone reports these cases, I believe things will get better. Because right now, people are not reporting cases. There are people who want to treat these patients at home, and at the end of the day, everyone gets it. So that's the answer to that.
Okay, thank you. Okay, so we need to bring the discussion to a close. We're running out of time. I think maybe we have one more question, and then we'll bring the discussion to a close. Does anyone from the panel want to put something forward, or is this still?
There was another question.
Yeah.
It was about social mobilization here. Someone said in South Africa the radio presenters don't talk about Ebola a lot. In Sierra Leone here, actually, what is happening now is a lot of radio stations and TV programs are now taking Ebola and discussing it. So,
and in addition to the measures, nationally we have 2 cities quarantined. Traffic in and out very, very limited. Only health personnel and political authorities are allowed in or out of these places. And there has been a ban on social activities from 7 p.m. to 7 a.m. nationwide. People are not to gather in bars, entertainment centers, no nightclubs or anything.
no cinemas.
No cinemas. So this is to discourage
No, not even
social
football
intercourse.
matches.
Okay, thank you.
Hello?
Yeah. Hello.
Yeah, there's one more question I was asked about the socio-political dynamics about the whole epidemic locally.
I think we lost a bit.
Countries and them. Hello?
Yeah.
Hello?
Yes, we can hear you. Go ahead.
Yes, I was on the question that was asking about the socio-political dynamics with regards to the epidemic. The rest of the government, apart from the ministry, and even within the ministry, there was some denial as to the existence of the whole disease and whether its existence in Sierra Leone. And for most people, we thought it would never come. It was just going to be Guinea. And then even when the initial cases came, they almost took them for a cholera outbreak, because it's the same period we normally have a cholera outbreak. So people almost take it for that, and they have to reverse and say, no, let's check some of these patients that are going down with vomiting and this, and it came out Ebola. So there was a lot of denial and hesitance and naivety, partly because it's new to them and it's new to this region, and so there was this slowdown on the political side. And on the social side, yeah, people interact a lot. They with both when people are sick and then after funerals, they go to these funerals. Some of them go as far as taking them back to their village and pay a lot of respect and to before finally laying them to rest. And so these all have a toll on the day, because some people are attending funerals at the epicenters, and they have to return again to their homes, which involves the rest of the county going. So in the process, they were taking back the infections because they were attending these funerals at the epicenter, not knowing what killed these people. And then as they return to their homes and their regions, they're taking the infections with them. And so before you know it, it was all over the county. And so that's contributed to the overwhelming nature of the disease spread all over. But for now, the government, the political will has been there. They've announced a state of emergency for the entire county, and they've stepped up. And socially, again, people have been educated and given reasons as to why they have to be cautious during this period socially. And yeah, so I'll stop there for now. Thank you.
Okay, there is a question: are government or private companies there's a question I want to answer here, which says, are governments or private health companies such as MSF Medics Without Borders promoting prevention? Actually, private health organizations such as, especially MSF, is not doing any sensitization of. What they are doing is creating treatment centers and treating people who have gotten infected of Ebola virus disease. They are not doing any sensitization. Thank you.
Okay, thank you. We've run out of time for tonight's discussion. I just want to say a very, very big thank you to all of our panelists who took time out of their medical student schedule to be a part of the discussion tonight. We really do appreciate it, and I thank the guys at the Kick Ebola Out campaign. I also really appreciate it. Now, thank you to our viewers as well. Again, this is the first time we've really done a Google Hangout session like this. We have had a sort of a steady stream of viewers the entire night. What's really nice with this platform is that you guys can now watch this entire discussion again if you'd like to, but you can also share it because it's recorded on YouTube. So please, if you guys feel like family or friends or companies that would be interested in the Kick Ebola Out campaign, go onto social media, copy the link in the URL, or I'm sure there's a share button down there somewhere. Put that up on your Facebook or in your Google Plus account, and you can do a little bit to help the Kick Ebola Out campaign free of charge. Now, for medical students and other health professionals who would like to get in touch with either the panel or the other viewers of this, let's call it a webinar, I guess, you'll be able to contact individuals through Google+. It's a good social media platform. So, for instance, everyone who was invited or at least attended this evening's discussion, you'll be able to go through the Google platform to get in contact with them if you want to chat to them about any issues around Ebola, or if you'd like to start a project of your own. So yes, thank you to our viewers, thank you to our panel. I hope to see other African medical students using online platforms like this to further their own activist projects. I think this is a good start. This evening we had the student leaders from all over Africa, I mean Sierra Leone, Guinea, Kenya, South Africa, Tanzania, Nigeria. So, you know, these are the future leaders of sort of global health in the country, and you know, hopefully one day we're all going to be sitting down making health policies together. Let's hope. So I think interaction at a student level like this is very important for the future health of the continent. And these kind of events, if they carry on and are encouraged, I'm sure that you know, when we get a little bit further down the pipeline, you'll be seeing a lot of hidden talent coming out of the African continent. So yes, if anyone has anything else to add, we can call this discussion to a close. Maggie, Gerald, you guys have something to say?
Thank you, Chris. And I would just like to really emphasize on the part that, like you said, that it's a very good platform, and it's the first time that the Africa region has had a very a Google Hangout, and it's all thanks to you. And this just shows that as the African region, we do have the potential to go far, and we should not leave alone our brothers and sisters in West Africa, and we should do the little bit that we can, because small things brought together end up in one big thing. So we should stand up together with them.
So I just add on what Gerald said. Thank you so much, Chris. Thank you so much, Matthew, for setting this up for us. Thank you so much, Asad and Hadia, for such an amazing campaign, and for all the panelists for being here. We are looking forward to support you, and we urge everyone else to support you as well. And I'm looking forward to more of these interactive sessions, like Chris said. This is an amazing platform for us to share our thoughts, our views, and